Jennie is the Executive Director at the Canadian Brain Research Strategy. She drives the development and advancement of Canada's National Research Strategy of Brain and Mental Health, uniting a broad coalition to shape policy, funding, and research priorities. She leads the creation of Canada's first National Brain Strategy, uniting diverse stakeholders to strengthen and unify research efforts across the country. This includes engaging academia, patient advocacy groups, Indigenous stakeholders, public and private research funders, industry, non-profits, and government to align priorities and enable actionable solutions to advance brain and mental health for all. So it's a great pleasure, Jennie, and we look forward to your presentation.
Thank you so much. Thank you for that very kind introduction. I'm just going to share my screen. Is it up? Okay, excellent.
It's coming on, just 1 second. Yes.
Okay, excellent. So thank you all. It's a real honor to speak with you. And I regret that even though I'm based in Montreal, I wasn't able to join you in person today, but I really look forward to the virtual discussions. So I'm Jennie Young, Executive Director of the Canadian Brain Research Strategy. Our name is complicated because it's not so much about us as an organization, but really what we've been building, which is a national brain research strategy. And so today what I wanted to do was to share how we developed that roadmap. And it's really a story about bringing together researchers, funders, and others, but also recognizing government as part of the ecosystem that we work with, not just a funder to petition, and recognizing that we can align on shared priorities and in doing so, create the conditions for long-term coordinated investment in research and research infrastructure. So to situate brain research within the Canadian landscape, our federal government has been investing in major national strategies for AI, quantum, biomanufacturing, and each has clear funding commitments and long-term investment in infrastructure, as well as funding research. And so what we see is that brain and mental health research is really the next major gap. And we're hoping that we can position it as the next national strategy level investment. So the way that we created our strategy was really rooted in the vision of our early career researchers, where we realized it wasn't about, so much a specific research question, which as a recovering academic, I understand how that is, the tendency is to pick what is our strength and how can we work on that one question together. But our strength is really how we are doing science in a very collaborative, transdisciplinary, and open way. And as, everybody in the audience, I'm sure, is very aware, it's really infrastructure and research platforms that enables this to happen. And because we have this culture in Canada, we have very strong shared resources that have been invested in the past in Canada. And so we decided on these 6 starting priorities. Can everybody see my cursor when I... Yes?
Yes, we can see it.
Okay, thank you. Excellent. So we decided on these 6 initial priorities here, which are the concrete ways to build that collaborative, transdisciplinary, and open ecosystem. And as you can see, many of them are related to elements of platform science, including access and open science, having diversity, the training aspect, and especially the transdisciplinary aspect that happens at these research platforms. So this is really how the process unfolded. We carried out a number of wide consultations across the ecosystems with all of these key stakeholder groups that we mentioned before. And the process itself in the stakeholder engagement, this is how we really were able to rally and unite the entire ecosystem behind a single strategy and to advocate with a unified voice. Now, with the funders in particular, this is from our very first meeting. We asked them about their funding priorities relative to those 6 priorities, and you can see that there's very strong alignment. So in other words, the funding organizations in Canada have been actively building this open, collaborative, transdisciplinary ecosystem. And that's why there's been investment in many platforms and many open data science, open data sets, but then there isn't the coordination. And that's why they are on board with us advocating for a national strategy that can coordinate all of these efforts and really maximize the impact of their investments. So the key parts of what our version of a brain research initiative in Canada would look like is that we really need long-term, stable, flexible, non-project specific funding. And that's because our grants in Canada are relatively small. I worked in the US at MIT for 14 years, and it's just a very different funding landscape from the US, where you can support research staff, where if there are shared resources, they can be supported on long term because there's just much larger grants and much more many different sources of funding. And we really need long-term non-project specific funding to support these shared infrastructure. And that includes the kind of research personnel and resources that you need to connect these shared platforms and data sets, especially stable funding to keep specialized staff so that you can run these platforms at full capacity, and really ensuring that research everywhere can access the tools and data that's needed. And in a similar way, we need to invest in transdisciplinary training, and the language is really to align with how government looks at it. And that's because, as you know, there's a wide variety of scientific careers that are not just necessary, but really should be open for all researchers in the country. It's not just becoming a PI, but to have many other career aspects as well. And so this is how we were able to bring together this ecosystem, is because, it doesn't matter what disease area you're studying in the brain or what your research focus is, we have these common needs in the type of shared infrastructure, the type of collaboration that we want to undertake. And that's how we were able to bring everyone together with this unified strategy and with a unified voice. And so the question now is, how do we make this relevant for government, and how do we translate the importance of investing in health and health research into the issues that are relevant today? And broadly speaking, we need to answer the questions of why brain, why Canada, and why now. And to give more context, right now with the current economic situation and geopolitical situation, Canada is really focused on nation building, investments, and infrastructure. And it's in these classical natural resource areas like oil, gas, and minerals. And that's because politicians all around the world are worried right now about productivity and economic growth. And this is classically how we have built up economies in the past. And in this context, it's really easy for health, never mind health research, to really fall down the priority list. And what we're advocating for is that when we look at research, our natural resource is brain power, the knowledge, the skills, the creativity of our scientists. And we need to be investing in that just as we invested in those old natural resources like oil. And the infrastructure that our government has been investing in, like pipelines and so forth, that's the research platforms and the data systems that's needed. And it's really, we're arguing, a federal responsibility, because this isn't something that any single organization can take on. And so we can make arguments on the health impacts on productivity, because, and this applies broadly to many different health conditions, but brain conditions in particular are the #1 cause of disability in Canada and in the world. And we can look at this, seeing how they impact people across the lifespan. And this includes mental disorders, neurological, stroke. These are just some examples, and even infectious diseases like meningitis or even long COVID. And in Canada, 1 in 5 Canadians live with a brain condition. And so they're now not able to contribute to their jobs, to society, to their communities as well. And in addition, you have the care partners that are unpaid. And so this is how we can quantify the impact and start thinking about brain health in a way that is linked to productivity and the country's economy. This is also other data from the Institute of Health Metrics and Evaluation, where we can look at the lost income that comes from all of these different brain conditions and how it's increasing over time with age because of our aging population. On the flip side, we can also look at the positive brain health. So not just negative and dealing with brain conditions, but really recognizing that the future of jobs are going to require a lot more advanced brain skills, basically, whether it is analytical thinking or our flexibility, etc. We all know AI is not going to take our jobs anytime soon, but that means that we are doing more complicated things that need good brain health to be able to perform that. And altogether, this is the idea of brain capital, which is thinking about brain power, about the brain health and brain skills and investment in that as a natural resource that will power future economies. And we in Canada are making the point that our excellence in brain research makes it an enabler of a brain-powered economy. It's a way to unlock the brain capital because we have the knowledge and the means in order to make new models of care, to improve brain health, to transform how we learn and work. So it's not just a future thing, but really something that we need to act on now, and that we need to that we have the means to do so. And so we've been bringing it to the attention, for example, raising brain health and research at the G7 level. And this is significant because we're really putting these issues in the same policy space as AI, climate, and energy. And these are what is recognized as major drivers of global economic resilience. And it signals that investing in brain research isn't just a health or science issue, but really part of building the future economy and workforce. And so this was a summit that we held with both virtual roundtables and an in-person event in Calgary that was held at the same time as the Leader Summit in the Kananaskis, where we really highlighted all of the different sectors of society that are contributing to building a brain-powered economy already. So it wasn't that we were just sitting here waiting for government to act, but that a lot of work was already being done, and we need that government coordination to push it through. And namely, we needed government to recognize and reframe brain health as more than just a health issue, that it's an economic, workforce, and societal issue. And to be able to, that it was their role to empower different sectors to take action and really to make brain health a cross-sector responsibility. And so that's, and as you can see from the sponsors, this is part of a much larger global brain economy movement. But as I mentioned before, it's also part of a broader health economy framing where we start looking at health and health research as more than just a niche issue, but really an economic imperative that we need to act on now. So I hope that was useful and interesting for you. I want to thank everybody for your attention. I'm really curious to hear your thoughts on this approach. Building sustainable research ecosystems takes shared vision and shared stewardship. So I want to acknowledge that, and you can learn more about us and our activities on our website here. Thank you.